What started as a life-saving transplant took a tragic turn last month. A kidney transplant recipient died from rabies after getting that kidney from a Pensacola-based Air Force recruit who died in 2011.
Guidelines for preventing the spread of rabies came out 9 months after that transplant. We want you to know what's being done to protect you. Fox 10 News reporter Joe Salvatore spoke with a physician at USA Today.
Physician and professor of medicine Greg Rutecki says screening tests on donor patients for diseases like hepatitis or AIDS are completed quickly. They're uniform and required by guideline. But he says rabies cases are rare in humans.
Physicians don't see rabies enough to even diagnose it. I've never seen a case of rabies.
But it does happen. In 2004, an organ donation case in Texas resulted in 4 transplant patients dying from rabies. The organ donor in this case died from inflammation of the brain. No one tested for rabies.
And so I think what's going to change for the transplant community is people who die with severe inflammation of the brain are declared brain dead and then donate organs. We're going to look at them more carefully because now we have tests that will diagnose rabies more quickly.
The United Network for Organ Sharing maintains a database that helps matching organ donation candidates. It publishes guidelines for doctors on specific diseases, initiated after the 2004 rabies case in Texas.
I think it's important to make sure that the individuals who are making those decisions have as updated information as they can, as reliable information as they can. And that's really of interest to all transplant candidates, everybody who's waiting for a transplant.
But the UNOS guidelines on rabies took 8 years to publish because of the rarity of the disease and the lack of data to review. It wasn't released until 2012.
I mean, we want to make sure that we have good data. We want to make sure that we look at the medical information so that we can give sound advice and sound recommendation.
We use them. I mean, there's no question if you're involved in a transplant process that we rely on that because they're in a strategic position to know exactly what's safe, what research is going on, so they inform us, and yes, the guidelines from UNOS are used to the letter.
Dr. Rutecki urges you to seek medical advice if you've been bitten by any animal. That knowledge can potentially save a life. In Mobile, Joe Salvatore, Fox 10 News.
USA Medical Center closed its transplant program, forcing would-be recipients to travel, which presents another challenge to doctors and patients. We've posted information on organ donation for you on fox10tv.com.